On the Medical Watch, GLP-1 medications similar to Ozempic and Wegovy are becoming more accessible. While these drugs can help shed a few pounds, they do come with other risks and side effects.
And joining us this morning is Dr. Tony Hampton, a family physician with Advocate Healthcare. Dr. Hampton, thank you for joining us this early Saturday morning.
Yeah, it's very early, but I'll do anything to help people heal, so I'm okay with the early part.
Yeah, absolutely. So again, we mentioned that you're a family physician, but you also have an expertise in weight loss and helping people reduce obesity. Talk a little bit more about that.
Well, I think it's important that people understand that one of the biggest causes of metabolic disease and chronic illness is obesity. So if you focus in that area, you'll probably be able to reduce the risk for like most of the so-called chronic diseases. So as a family doctor, once I recognized that, I said, let me get more training in that. So I got board certified in obesity medicine. I also got a master's in nutrition so that I can help people understand that food is medicine. And with that approach, you can do miracles. The problem is people kind of know that. So my job as a doctor and as a health system with Advocate Health is to coach people and support them because they're going to struggle. We just got through the holidays. They're going to struggle. My job is to walk with them through that struggle. And if we do a better job of that, we're going to do fine.
It's got a lot of people that are going to be having their New Year's resolutions to lose weight and get in better shape. Is this one of the options? And what should people do? Because Ozempic used to be the big word like a year and a half ago, but now you have all of these other options. Talk about those options. What are the risk factors for doing that kind of if you go off on one of those online pharmacies?
I think for me is to understand what is this GLP-1, what does it even mean? So glucagon is secreted and what it does is it reduces it tells your liver to make more glucose or sugar. Okay. So GLP-1's glucagon-like peptide, what that does is it actually blocks glucagon. So you actually make less glucose, and as you know, glucose will turn into high insulin and you'll gain weight. So, but what it also does is it actually tells your body to it slows your gastric emptying, so you feel full. It'll tell your brain, guess what? I feel full, so you don't feel hungry as much. And it also increases insulin sensitivity. So that's what it does. Now, having said that, what's the problem with GLP-1s? Number one, financial. Many people in my practice on the south side of Chicago, they simply can't afford it. Even if their insurance covers it, sometimes the co-pays are prohibitive. 80% of the people who do it and get off of it will regain the weight, 80%. And then, but there are other side effects, pancreatitis, intestinal obstruction. I've actually had people have a gastric obstruction because of the medicine, which is very concerning. Thyroid cancer, that's another one. Gastrointestinal side effects like nausea, vomiting. Believe it or not, it affects your eyes. The same diseases that diabetes cause, and we're using this medicine to treat that, it can cause retinopathy and something called macular edema. I mean, the same, so it doesn't make sense.
So
and then you have other
your
stuff.
approach then is a more natural approach
to
nutrition and exercise,
absolutely.
if that's possible.
So there's a couple of things to think about. I think a ketogenic diet is very effective because a ketogenic diet will reduce your hunger. So that's one option. There's something called the satiety per calorie method. How about this young lady in Australia, Susanna Holt, came up with this concept, and then it was popularized by the diet doctor, Dr. Andres Einfeld. This is a #1 low-carb site. And basically, let's eat the foods that make us feel full.
Sure.
Things like animal protein, non-starchy vegetables like asparagus, spinach, etc. Those are very effective. The more obvious things, though, are sleep, stress, exercise, and we talked about that a little bit before we started. And lastly, there are supplements. So I call it the big five. Berberine, we call that like it's like metformin. If you can't tolerate berberine, is very effective. Inositol is another that decreases insulin sensitivity. The other big of the big five is something called Gymnema sylvestre, and they call that the sugar destroyer because it takes away the sweet taste in your mouth. 5-hydroxytryptophan, that's another thing that turns into serotonin. So when you have this emotional eating, it'll decrease it. And the last thing is apple cider vinegar.
Okay.
So those are the big five, and the big five is an acronym, so you can remember those.
Well, if you need any information, you go to Dr. Hampton, because you know yourself, obviously.
We need you to come back.
That
yeah,
extra
no
board
doubt,
certification
no doubt,
helped
no
out.
doubt.
Dr. Hampton, thank you so much. Do appreciate it. Happy New Year
Thank
to
you.
you.
Appreciate it.
All right, and you can find Dr. Hampton's book, Fix Your Diet, Fix Your Diabetes, on Amazon. Again, thank you so much for joining us.